All right, welcome everyone to CalAIM Educational Series Part 8. This is Growing Together, Family, Maternal, and Child Health Programs Overview. And up first, we've got presentation on Family, Maternal, Child Health with Anisha Johnson. She's the Senior Health Education Specialist with Black Infant Health, and Karen Vargas, also Senior Health Education Specialist with the CPSP and SIDS program. And Karen, I'll turn it over to you.
Thank you. Welcome, everyone, and thank you for being here. Today, we will be giving an overview of the Family, Maternal, and Child Health Programs, also known as FMCH in Contra Costa Health. And today, I'm presenting with Anisha Johnson, and she'll be coming on later, our Senior Health Education Specialist from Black Infant Health. And like Chris mentioned, I'm Karen Vargas, the Senior Health Education Specialist from the Comprehensive Perinatal Service Program and SIDS program, Sudden Infant Death. Later in this presentation, we'll have Marlene Ceballo from WIC, who will also be presenting, and we're excited to share our programs. We'll go on to the next slide. So our family, maternal, and child health programs are designed with the belief that every family deserves access to affirming, culturally relevant, and supportive services. Our vision is a community where all individuals reach their optimal level of health. The mission reflects our partnership with local organizations to reduce inequities and improve lives across generations. Everything we do is rooted in prevention, equity, and community empowerment. FMCH includes a variety of programs, and we will touch base on each one of these as we go on in the presentation. So we have first the Nurse Family Partnership Program, also known as NFP. This is a nationally recognized evidence-based home visiting program for first-time mothers. And to be eligible, you must meet 3 criteria. So the first one is to be low income, which typically includes Medi-Cal or WIC eligibility, be a first-time mother, and be less than 28 weeks pregnant at the time of enrollment. This program pairs clients with a dedicated public health nurse who provides one-on-one support throughout their pregnancy and to early childhood. And the nurse and program supports moms by conducting health screenings and assessments. They also provide parenting education and infant development guidance, offering referrals to healthcare, childcare, and community resources, and helping mothers identify ways to continue education or gain job skills. A key part of this program is goal setting, so supporting clients in shaping their future and becoming the best parent that they aspire to be. Similarly, we have another program, but it's the Prenatal Care Guidance Program, also known as PCG. And this program provides essential support for Medi-Cal eligible pregnant women and birthing people in Contra Costa County. This program ensures that clients are connected to appropriate prenatal and perinatal care early in their pregnancy. To qualify, the individual must be low income and Medi-Cal eligible. They must live in Contra Costa County and be pregnant at the time of referral. Our services include helping clients gain access to healthcare coverage and prenatal care, connecting them to prenatal providers, promoting women's health during and between pregnancies, educating families on pregnancy, parenting, and reproductive care, and lastly, linking clients to appropriate services like Healthy Start, etc. Moving on, we have the Adolescent Family Life Program, known as AFLP for short. And this program supports pregnant and parenting youth across Contra Costa County. To qualify, participants must be a Contra Costa County resident, be 21 years old or younger, and be either pregnant, parenting, or working towards gaining custody of their child. This program is designed to be youth-centered, offering one-on-one support through positive youth development case management model. That means we focus on three things: goal setting and achievement, building resilience, and connecting youth to key resources and supports. And the great aspect of AFLP is that both mothers and fathers can enroll, and the program is flexible. So the participation can either be short term or long term, depending on each client's needs. So ultimately, the goal is to empower young parents to create a stable, healthy future for themselves and their children. The Safely Surrender Baby program offers a safe and confidential option for parents who feel they cannot care for their newborn. Under California law, a baby who is 72 hours old or younger can safely be surrendered at designated sites, including fire stations, emergency rooms, and county health centers, without fear of prosecution. This law was created in response to infant abandonment and became permanent in 2006. It aims to prevent unsafe abandonment and save lives. So these are a few key things to consider. First is there's a 2-week grace period during which a parent or a legal guardian can reclaim the baby. At the time of surrender, a bracelet is placed on the baby for identification, and matching bracelet is given to the surrendering party. A medical questionnaire may also be offered, but it is completely voluntary and intended to gather any helpful info for the baby's care. And most importantly, no questions will be asked. So the California Penal Code Section 271.5 protects the individual from prosecution for abandonment. The department, our department helps by updating and distributing safe surrender baby packets, and we do community education as well to raise awareness about this option. So the core message is there is an option, don't abandon your baby, and this program provides a compassionate, judge-free solution in times of crisis. Our sudden infant death syndrome program or infant mortality support program exists to support families affected by the sudden loss of an infant to prevent future tragedies through education and outreach. We receive referrals from the following, including hospitals, clinics, the Office of Vital Records, case management programs, and perinatal providers. Once a referral is received, our teams provides several types of support, including family grief and bereavement support, data collection, and case review, which contributes to countywide infant mortality understanding, and provider education. For example, we offer SIDS risk reduction recommendation presentations from the American Academy of Pediatrics. We also help with community education and awareness campaigns. Additionally, our team will offer trainings to hospital and clinic staff, child care providers, public health nurses, and first responders and law enforcement. So again, these teachings and trainings are rooted in the most current research and emphasize key safe sleep practices, like placing babies on their backs to sleep and maintaining a smoke-free sleep environment. Next, we have the Community Oral Health Program, also known as COHP. And this program plays a vital role in improving oral health access for children, youth, and families in Contra Costa County. The program does this by partnering with schools and community organizations to connect families to a no or low cost dental care, which is especially important in underserved communities. COHP includes two main components: the Children's Oral Health Program, which has been active since 1977, and this program focuses on prevention and access to care for kids. Then there's the local community health improvement plan, which takes a more broader view, looking at system level changes that can improve oral health outcomes across the county. And more recently, COHP has expanded beyond direct services focusing on assessing community needs and working collaboratively with partners to build comprehensive strategy that addresses oral health equity countywide. So overall, COHP is not only about getting kids to the dentist, but it's about a long-term community-driven solution to improve oral health for everyone. And here you'll see some resources for the community, including the dental clinics in Contra Costa, our general oral health presentation and oral health topics. We have Smile California, which is Medi-Cal Dental, and other services at Contra Costa school sites. And on the next slide is also smilecalifornia.com and our dentistonwheels.org page. Next, I'm going to hand it off to Anisha.
All right. Hello, everyone, and thank you so much. All right. I am Anisha Johnson. I'm the Community Outreach Liaison and also a family health advocate, and I am going to talk to you a little bit about the Black Infant Health Program. So, the Black Infant Health Program serves Black women throughout the state of California. We have many different sites throughout the entire state. We have about 18 different jurisdictions. We have been serving the community for over 35 years. Our program follows a life course perspective, meaning that we really look at the whole person and look at the whole care. So, we're not simply just interested in mom, but we're really interested in what is her emotional health, what is her physical health, and how can we support the different stressors that she is experiencing so that she can have a healthy birth outcome. Some of our program goals are to empower the mom so that she has the resilience needed to have a healthy birth. We want to make sure that she is connected with a medical home. We want to make sure that she is engaging in services and care that is culturally relevant and really important to her. And also, we want to improve and support her by letting her know what things are involved in having a healthy pregnancy and a healthy birth. And a part of that is helping her to build healthy relationships with other peers. So, kind of the cornerstone of the Black Infant Health Program really is the group sessions. So we offer 10 prenatal group sessions done in a cohort-like model. And then we offer 10 postpartum group sessions, again, done in a cohort model, where moms can come into our program, receive support from a family health advocate, and also make friends with other moms in the community. And their babies can make first friends too when they're a part of the postpartum support. Now I'm going to talk to you a little bit about eligibility, how a person can refer and who is eligible to be a part of the Black Infant Health Program or the BIH program. So, the first thing is that it's up to the individual to choose how they identify. So, a mom can identify as Black, she can identify as African American, she can identify as African, she can identify as Afro Latinx. Any of those cultural identities are perfectly fine for a person to enter into the Black Infant Health Program. She can identify as mixed race. It really is up to that individual of how they identify, because the point of Black Infant Health is to offer a cultural appropriate service that really respects the participants' values and the beliefs. So we have three different programs that are available for a person to come into the program. The first program option that we have available is the prenatal group. So for a person to be eligible for a prenatal group, they need to be at least 30 weeks pregnant or less. They do need to be able to attend 10 weekly groups, and they need to be able to meet with their family health advocate on a one-to-one basis, as well as attend the groups. So every person that attends the prenatal group sessions not only gets the support of the other moms in the group, they also get the support of an individual family health advocate. And that health advocate is going to meet with them more closely to really look at the type of birth that they want to have. So we do birth planning to help them set some life goals and also to link them up with different community services and referrals. Then we have the one-to-one support program. This is for a person who is either pregnant or has already delivered, or for someone who maybe is under the age of 18 years old. We're proud to say that our program does support teen moms who are 16 years or older, but we are only able to support our teen moms through our one-to-one support program. So when they come into the one-to-one support program, they really are able to identify and choose what is best for them that they want to focus on in terms of goals. So for some people, it might be that we need to focus on their mood and their stress, and they want support with maybe getting connected to a mental health professional. For example, or getting into some therapy services. And for some other people, it might be best that they focus on things like the health of baby. They want some baby development information and want to be connected to things that are in the community, such as other resources and things like that. And in that case, the family health advocate will make those referrals. I think one really important thing just to note is that with the prenatal group and as well as the one-to-one support program, a Black infant health client can be dually enrolled. So they can be enrolled in ECM. They could potentially also be a nurse family partnership, an NFP client, and they could be a Black infant health client. And I'm going to explain to you why that's the case when we start looking at the statistics that are impacting Black birthing people. Lastly, the other intervention that a person can enter into when trying to access the BIH program is the postpartum program or the postpartum group intervention. A mom can enter this program up to 6 months postpartum after she has already delivered. And when it says 6 months, it means that she has up to 6 months to join a postpartum group. Up to 6 months. Lots of times folks enter in around 1 to 2 months postpartum, after they have kind of like settled in with baby, and now they're ready to get some peer-to-peer support, get out the house, and really just kind of get some connection going outside of care for baby. And again, we're going to be focusing on important maternal and child health topics such as safe sleep, perinatal mood and anxiety, as well as looking at different community resources and referrals. Let's talk a little bit about the statistics that are impacting Black birthing people right now. So we know that when we look at national infant and maternal data as a whole, at a global level, the US does have the highest rate of preterm birth and maternal and infant mortality rate. And we are higher, we're elevated than any of the other countries, even the more industrialized countries in the world. And then when we start to look at Black birthing people, particularly, we find that Black moms have 3 to 4 times more, they are 3 to 4 times more likely to have either a complication or die after childbirth. We're also seeing that Black babies are 2 to 3 times more likely to be born too soon, which is before 37 weeks gestation, or too small, which means a baby is born below 5 pounds, 8 ounces, or even not make it to their first birthday party. These statistics are particularly striking and really is causing for a national response to really look at how we can support Black mothers to have better birth outcomes. So, Black infant health in the state of California is one intervention, and there's many other interventions and community partners that are working together to really understand what the drivers of these health inequities are. When we look at drivers of health inequities, we look at structural racism. We know that it is actually not race that is driving these statistics, but rather it is racism and implicit and even explicit bias that are causing these types of inequities. We know that the stress that mothers experience in their pregnancy, and when we look at the life course model, not only is the stress that they experience, but what was the stress that her mother experienced and her mother's mother? How is that having an impact on that woman and on her birthing outcome? We know that there are other things that kind of further complicate the health of moms and make it difficult for her to have a healthy pregnancy and birth outcome, such as wondering about where she is going to sleep. We have clients that are dealing with being unhoused, who are marginally housed, who are experiencing food insecurity, and who are experiencing lack of transportation. And so it's all of these things that we really take into account and to look at and try to give different resources for and work with our different partners to help to address some of these different things. We would like to highlight some of our community champions, such as Senator Holly Mitchell, who worked tirelessly to establish the California Perinatal Equity Initiative, otherwise known as PEI. Because of Senator Holly Mitchell's advocacy, we were able to get an initiative established and put into law. And it states that this initiative is intended to address the causes of persistent birth outcomes and to identify the best practices to improve disparities in infant mortality. And to date now, we have 11 counties with Black infant health who have a PEI operating initiative. We also have a joint community advisory board. This community advisory board is open to Black infant health families. It's open to service providers and CPSP providers, as well as other family and child health maternal programs and those providers all to come together underneath one mission and one purpose, which is to expand the efforts to improve maternal health and birth outcomes for Black moms. We are also excited to say that because of PEI and because of the work of the Community Advisory Board, the community decided that there were three main areas that needed attention. And those areas that were identified from the community were that we needed a doula program. They also identified that we needed a specific Partners in Pregnancy Fatherhood program. And recently, the board voted and decided that we needed a nutrition support program that would provide warm meals to moms 3 times a week for the first 12 weeks postpartum. The campaign is also, the PEI initiative is also coupled with a campaign called the Deliver Birth Justice Campaign. And this campaign ran throughout the state of California. There was a photo piece of it, and it really kind of just highlighted again the mission and the purpose of PEI. Our doula program kind of serves as the sister to Black Infant Health. This makes it available for Black infant health clients and Black identifying birthing people to have a community-based doula. This community-based doula is able to come out and do home visits, talk to moms about prenatal care, talk to them about their breastfeeding goals, and screen for perinatal depression. There's no income involved, and there's no health insurance eligibility or criteria that is involved with this either. And again, the reason for that is because the data does tell us that even when we look at increased grade, like we look at a mom who might be in a higher income bracket, and we look at mom who might be in a different area in terms of geographic, none of those things help to reduce the statistic. The statistic still remains the same. So we always say in Black infant health that you cannot earn or learn your way out of these statistics. It's very important for every Black birthing person to have the opportunity to opt in to these different services and really get this enhanced service during this important time in their life. Along with that, we want to make sure that partners are not left out. Dads are really critical to mom's care and to her emotional wellness. The fatherhood program is operated by Aspiranet in collaboration with CC Health. They do use a curriculum called 24/7 Dad. Dads can meet with a fatherhood specialist either individually or in group sessions. And the sessions focus on dad's self-awareness, their own self-care, their own adjustment, as well as their relationship skills with how they are supporting moms. There's also booster sessions where we look at dads that maybe don't have full custody of of the child. We look at how visitation is taking place, what are their rights and responsibilities, and how they can just kind of get involved. And again, there's no income limit or eligibility criteria for the fatherhood program. And it doesn't matter how the father identifies as long as the mom is a part of the Doula program or the Black Infant Health program, the father can be a part of the Partners in Pregnancy program. This slide here is highlighting our new nutrition support program that we talked about earlier. The nutrition support program that is going to be available for postpartum moms is going to be a collaboration through MPJ, Mothers for Postpartum Justice, as well as the 18 Reasons nonprofit. This program is going to be available for moms, again, who are BIH moms or Cocoa Doula parents, as well as fatherhood program participants. And for this program, it won't be that the community can can apply directly. It would be that the case manager will go ahead and put the referral in. We request that all healthcare professionals focus on the importance of learning how racism and bias harm Black mothers, birthing people, and babies. We are requesting that you be an advocate in your own space, that you welcome doulas and midwives into your work, into your spaces, and that you refer clients to the doula and to the fatherhood program. We know that to establish a system to report and to really address racism is going to be a community approach that takes us all working together. And as a part of us all working together, it also means learning how to refer. So there's a couple ways that you can refer. You can refer just by going to the Family, Maternal, and Child Health website. You can pull up the FMCH referral form. You go ahead and put your name and a good contact number for you, and then you can put the patient that you would like to refer. And this is for providers who are kind of external outside of CC Health. And then for those providers that use CC Link, there is also a way that you can refer using CC Link. And what you would do is you would bring up the patient's chart. You would just go to add order in the bottom left of the screen, and then you can just type FMCH or Ref 324, and that will go ahead and allow you to submit the referral using CC Link. And then don't forget that lastly, before you close the chart, make sure that you sign that order so that we can make sure that we know who is submitting the referral. And one thing that I want to say about when you refer to the Black Infant Health Program or to any of our family and maternal child health programs, it really is more important that you just submit the referral. Once the referral comes over to our department, we will contact that client. We will assess for the acuity of the client and really make sure that they are matched to a program that is the best fit. We would like to highlight some of the clinical toolkits that really help to drive our work and help to improve health equity. So when you have time, please check out some of these different resources that are available to you. I would like to point out marchofdimes.org and also shout out some of our other county agencies that are doing this amazing work, such as Alameda County and Frontline Doulas. These are all great resources for anyone looking just to deepen their understanding of Black maternal health. And at this time, I would like to turn it over to Marlene Sabello.
Thank you, Anisha and Karen, for your wonderful presentation on the Family Maternal Child Health Programs. I'm so happy to be here with all of you today. So my name is Marlene Sabello. I am a registered dietitian as well as a lactation consultant. I work for the Contra Costa WIC program. The WIC program has been around for 50 years, believe it or not. So last year we celebrated our 50th year anniversary of being in the community, and we're really, really proud of, all of the work that we do to bring nutrition security to families. So as you know, WIC stands for Women, Infants, and Children. This is our mission statement: to provide all women, infants, and children healthy food and the knowledge and opportunity to make healthy choices in an atmosphere of dignity and respect, thus enhancing the potential for all Californians to enjoy a higher quality of life. So we are a federally funded supplemental nutrition program that is run by the USDA. We serve expecting parents, postpartum individuals, fathers, legal guardians, foster parents, adoptive parents, and military families who have children who are under the age of 5, so 0 up to their 5th birthday. An interesting fact that you may not know is that more than half of the US infants are actually participating in the WIC program. So there's a lot of folks who don't know that. Our WIC appointments are based on a category-based system of participation. So you can participate as a prenatal individual, during the postpartum period, as a breastfeeding individual, combo feeding infant or individual, a fully formula feeding infant, a high-risk infant, child, or woman, a child from age 0 to their 5th birthday. We also support individuals who have gone through a miscarriage or termination, and we will provide temporary WIC services for 6 months from the date of the loss or the termination. So we help them with nutrition education. We pair them with a lot of outside support, ECM if they're eligible, etc. And all of our appointments are centered around nutrition, breastfeeding education, goal setting. We have a lot of motivational interviewing. And we also are a place where folks get access to a lot of referrals. So many of our FMCH programs, we refer all of our families to those programs, and any others that are within the community. Um, So the programs of our, the goals of our program are, they're research based. We have a lot of research that supports pregnant individuals who are participating in the WIC program actually seek care earlier during their prenatal period. They consume a healthier diet because they have access to the education. Our WIC participants also have longer pregnancies, which is really important, right? We want fewer preterm births. We want fewer low birth weight babies, and we also want fewer cases of infant deaths. And so um, there is research that shows that individuals who are participating in our program have better outcomes. Also, the children who are participating in the WIC program have been shown to have improved growth rates. They have a decreased likelihood of having medical issues. And really, this translates to really enormous savings in our healthcare costs. This is our WIC eligibility criteria. So the qualification for the WIC program is income-based. If they are an individual already receiving Medi-Cal, CalWorks or TANF or CalFresh, they are automatically adjunctively eligible for our program. So this shows the federal poverty level. So the gross income needs to be 185% below federal poverty level in order for them to participate. These income guidelines are updated annually. So every April, we get new guidelines from the federal government on the WIC eligibility as well as Medi-Cal eligibility. So another fun fact that a lot of people don't know is that as of April of 2025, our Contra Costa WIC program was serving just under 20,000 families. So we're really out here in the community, and so that just shows you the depth of our reach. Immigration status is not a consideration when determining WIC eligibility for our program. And we are not a public charge, so it does not count towards any immigration status. So we don't ask any questions about immigration. Oops, sorry, wrong way. In August of 2020, we were so excited that the California WIC program finally transitioned to an electronics benefit transfer system. This was with the rollout of the California WIC card that the individual is holding. And we also have a WIC-wise computer software system. So this is where all of the infant and child and parent information is input. It is a state monitored system. We also report all of our information to the USDA. So it's really been a very helpful system. This electronic benefits card works like a debit card, is reusable. Our WIC participants set their own PIN number for the card, and all of their food benefits are loaded electronically. So there's no need for them to come into the WIC office to get their food benefits loaded to their card. Everything is done electronically, which was exceptionally helpful during the pandemic. So we're really happy that this did roll out for us in 2020. Another interesting fact that folks didn't know is that WIC participants are really supporting the local economy through their purchases. It's, we're directing government dollars into the local economy. And so we're really helping with sustaining jobs and the local supply chains, particularly supporting local agriculture. And I'll talk a little bit more about that later. Along with this new card and software system came a new app. So we have a software application for Android and Apple iPhones. So they can get appointment reminders. They get to see what their available WIC food balances are by using this app. There is a UPC scanning on here. So if they're not certain if the product that they're trying to purchase from the store is WIC covered or a WIC food or an authorized item, they can actually just scan the barcode and it will tell them on the app whether it's a WIC food or not. They're able to check what foods are approved to purchase with WIC before they actually go out shopping, so they can, kind of create their shopping list and be ready. They can see where all of our WIC office locations are. And they can also, if they're, not at home and they want to do food shopping before they get home, they can actually see within their area by putting in the zip code which authorized food vendors are in the area, so where they can purchase their WIC food items. This is just an example for you to see what the food packages look like. So we are a supplemental nutrition program. And so when folks are using that EBT card out in, at the local grocery stores, these are the food items that they are eligible to purchase. So there is a little bit of a mistake on here. It says $11 for fruits and vegetables under the pregnant mom's food package. Actually, she receives $47. So we've had an increase in the fresh fruits and vegetable benefit for our WIC program participants. So any mom who's participating and is pregnant, she's actually receiving $47 for fresh fruits and vegetables rather than $11, which was the old price. And the child as well. So the child who's participating on the program will be getting $26 for their fresh fruits and vegetables. Here, there's a little bit of a mistake on the slide. It shows $9. So I just wanted to point that out. If they are breastfeeding, which is the following packages here, they actually get $52 for fresh fruits and vegetables. And if they are breastfeeding more than one infant, so say they have a brand new baby or they had multiples, and they have another child that they're breastfeeding who's also participating on the WIC program, they can get $78 for their fresh fruits and vegetables. So really, really helpful for their nutrition. In this slide, I wanted to point out that WIC provides different food packages depending on whether the individual is breastfeeding or formula feeding their infant. For fully breastfeeding participants, they are going to receive the most extensive food package. It does include more nutritious foods and comes in larger quantities because they're actually breastfeeding and they require more energy and nutrients to produce that breast milk. And so it is an incentive program for breastfeeding because the mom, one, gets more food in larger quantities. And two, she actually gets to stay on the program or is eligible for the program for 12 months rather than 6 months. If she chooses to use infant formula or it's medically necessary for her infant, WIC will provide that infant formula as part of her benefit, but she will have a reduced amount of food. So if you see here, fully breastfeeding individual will not get, a mostly breastfeeding individual or some or no breastfeeding will get less foods than the fully breastfeeding individual. And so for the infants, the amount of formula that is provided by WIC is going to vary based on the infant's age and how much breastfeeding the mom is doing. And then if at 6 months, as you see in the photo here in the middle, they start to receive infant cereals, which are higher in iron or rich source of iron. And that's, necessary for their growth and development. And then they start to introduce solids at 6 months, which is the nutrition education that they receive from us. So they will start to get those jar foods, or the mom can, or the parents can utilize the money that they're receiving for the fresh fruits and vegetables, which is loaded to the car so they don't actually get cash like money. It's electronically loaded to their card and they can purchase the fresh fruits and vegetables using that EBT card at the grocery store. So they can make their own fresh fruits and vegetable purees at home when they start introducing solids for their child when the child turns 6 months old. Individuals, like I said, who are enrolled during pregnancy get to stay on the program for 6 months to a year, and that is depending on their breastfeeding status. Infants who are staying on the program from 0 to 5 years of age, so when they have their 5th birthday, their eligibility is they have a recertification process that goes every year. So every year they have to recertify on the program. Other WIC services, in addition to supplemental nutrition, we have a breastfeeding support service through our peer counseling program. This is for first-time moms, any high-risk moms who have had, breastfeeding failure is what we call it in the past, or has had challenges with breastfeeding. She can have a breastfeeding peer counselor. So this is someone who works at our WIC office who has had experience with breastfeeding and can help support and promote breastfeeding and, with that individual who might be having a challenge. They have additional appointments with their breastfeeding peer counselor. They have longer appointments as well as needed. And so it's really helpful. They're almost like a cheerleader for that individual. It's really particularly helpful for those moms who might actually have a preterm birth, might be separated from their baby and just need that extra support. We also have a breast pump loan program. We have one with Kaiser as well as, so Kaiser in Antioch, as well as Contra Costa Regional Medical Center in Martinez, where we provide hospital grade breast pumps for any individual who's being discharged from the hospital and they may be separated from their baby or they need to increase their breast milk supply. They can get a hospital grade breast pump if they are a WIC participant. So this is a WIC pump. They're discharged with the pump, so they don't need to come to the WIC office. They take it home with them, and then we make an appointment and they're followed up by a lactation consultant. We also offer back to work or school pumps. So these are personal use pumps for any individual who's going back to work or school and needs this personal use pump. We have an appointment with the individual. We discuss, what their goals are, and they can come to WIC and pick up one of those personal use pumps. We have lactation support across all of our sites with skilled lactation professionals who are internationally board certified lactation consultants. And all of our WIC staff have received a minimum of 45 hours of breastfeeding education. So anyone who answers the phone at WIC has received extensive education and is able and ready to support anyone who has questions related to breastfeeding support. We also offer individual as well as one-on-one classes. We are offering hybrid services to our families. So this means that they can have their appointments in person or on the telephone. For their screening, for their enrollments or their re-enrollments or recertifications. We also use Zoom for Government to host our nutrition education as well as breastfeeding support classes. And we either, as I said, do this in a group setting or one-on-one. And then for those who want to do more like a self-paced, on their own learning, we actually have wicchealth.org, which offers a variety of classes. There's, I think, over 60 classes that our WIC participants can choose to take. And it's self-paced, so they can log in whenever they want to, complete the class. They can start it, pause it, and then finish it up. And they do get a certificate at the end showing that they've completed a class. And so this has been very helpful for our WIC participants, and they actually really enjoy it. These are our WIC locations. So we have 4 actual offices. So we have one in San Pablo at behind the West County Health Center. This is one of our newer sites. We have the Concord WIC office that just recently moved to Sistron Drive. We have Brentwood WIC, which is at the Brentwood Health Center, and we have our Pittsburgh WIC site, which is at the Pittsburgh Health Center. We do have a satellite location with our Crossroads High School, which is not pictured here. Crossroads High School is with the Mount Diablo Unified School District. It is a special high school for pregnant and parenting teens. They offer the opportunity for students in that school district to complete their high school diploma, with peers. They actually have an on-site daycare. So they are able to have their childcare while they go to school so they don't have to miss any classes. So the wonderful thing about this satellite location is that we go in to do their WIC appointments with them once per month. So it's either a nutrition class or breastfeeding class. And so they don't have to miss school to come to their WIC appointments, and they don't have to miss their WIC appointments because they're in school. So this is a really great opportunity in collaboration with the school district, and we really appreciate that we're able to do this. It's been very helpful. So these are the ways to refer to WIC. As Anisha had pointed out, the CC Link Epic referral, this is for providers who have access to Epic. They can complete the referral right there while they're in the patient's chart. They just have to search for WIC and choose which is the referral that they need. It could be a referral during pregnancy, a referral for the child if they're in a pediatric chart. It could be for therapeutic formula or for lactation support. So there's several WIC referrals that are in Epic. We also have a WIC website application. So if you go to cchealth.org/WIC and just click on apply for WIC, or if you just scan the QR code that's pictured here on this flyer, it will take you directly to that website, and you can actually fill out the application, and then someone from our office returns the call and starts the screening process. There is the old-fashioned way of sending the fax. We have a fax form that could also be found on our website, and it's under the tab it's called Forms under the Healthcare Provider tab. So you can complete that form. It's a PDF form, and then you can fax it to us. We also have a phone number, so 1-800-414-4WIC, and we also accept referrals via email. So you can just let us know, what the name of the person is, their contact information. We love warm handoffs. I always feel like this is a really nice way, for folks who are from another program to do a warm handoff for their clients or their patients. We really appreciate those as well. And our Contra Costa WIC supports breastfeeding, of course. Contra Costa Regional Medical Center, as well as Contra Costa Health, offers a lot of breastfeeding support. Our hospital is a baby-friendly hospital, so we do follow the 10 steps to successful breastfeeding, where we promote support and protect breastfeeding for individuals. We do have newborn clinics within our county. They are very unique newborn clinics because they are paired with a lactation consultant. So the baby is being seen by a pediatrician, and then the mom gets seen by a lactation consultant if she's experiencing any challenges, or she just wants to check in for any reason. That is an opportunity. So we have a newborn clinic provider lactation consultant at West County Health Center on Mondays in the morning, Fridays in the afternoon. At Pittsburgh Health Center, Monday afternoon, Wednesday morning, and Friday mornings. And then at Martinez Wellness Center, we also have one on Wednesdays in the afternoon and Saturdays in the morning. So providers can make those appointments through the appointment line or in Epic. We also have a Contra Costa Breastfeeding Task Force. We meet on Zoom on a bi-monthly basis. This is a multidisciplinary team. We convene to really talk about the services and support and access within our county, and really kind of, put our heads together to see how we can best support our patients with their breastfeeding goals. We publish a monthly newsletter. We also have a link tree with a lot of perinatal resources. So these links will be available once this is published on the website for you guys. You'll be able to click on things and get to see. So if you do scan this QR code, it should take you to the page where you can sign up for the newsletter if you're interested, or sign up to attend any of the task force meetings. The Zoom links are there as well. A really great, unique component of our healthcare system as well is that we do offer in-home lactation support. to our Contra Costa Health Plan members. So this means a lactation consultant goes to the home, they visit with the parent, and they help them with whatever challenges that they are, having. We also have a county lactation support warm line. This is run by volunteers who have had a minimum of 45 hours of lactation education. And so they, the warm line, the patient would call the warm line or the individual, leave a message, and then somebody would call them back, and then, help them with whatever issue they're having. And then we have our advice nurse unit that is always, ready to triage any issues that are related to breastfeeding to the right place. And I believe this is my last slide. That's it for me. Thank you.
Thank you, Marlene and Anisha and Karen. So that brings us to the end of this webinar. Up next, we have Part 9, Successful Reentry, Services for Transitioning from Incarceration. That's coming up on June 23rd, 2025 at 1:30 p.m. We'll have presenters from CCH Detention Health, California Support Services, and Rubicon Programs. And as Marlene mentioned, the slide decks will be posted, so any of the links that you've seen, you'll be able to click on them, so keep an eye out for that. And that'll be it. So thank you all for attending.